We're back, and we're going to talk about stopping the pain. Down on Battlefield Parkway is Dr. Prey's office, Prey Chiropractic, and we're going to talk to Dr. Nick tonight. He's going to talk to you about a lot of things. You got a lot of questions. You had a lot of questions on the morning show, and we got a lot of things to ask him about. And I guess probably back pain and sciatic pain, and that's probably the most pain that people come for. Would you say? And headaches.
Headaches, neck pain, arm pain, leg pain, pain from disc problems. There's just so many conditions that we treat. And a lot of times people don't realize they come in, I've got that sciatica problem. They don't realize there's so many things that can cause sciatica. There's multiple nerves that come out of the lower back, and it can be from a disc problem, from a jamming of the vertebra, congenital problems.
So it would still be sciatic.
Well, yeah, it affects the
or it could be
branch of nerves. Yeah, what people need to realize is when in the lower back you have a branch of nerves that come out, and they actually form two trunks, and those two trunks are part of what is called the sciatic nerve. So, sometimes when people give your friends or your mama says, when I had sciatica, the doctor told me to do this, it may not necessarily be the best advice for that particular person. And I'm like, quit talking to your parents and everybody. Listen to what I have to tell you as far as where this is coming from and how not to aggravate this. So we get that all the time.
What does aggravate it?
Oh, it just depends on bending, lifting, stooping, sleeping wrong, repetitive motion at work. Once you have injured your lower back, that area is weakened. And so there's, even the way you sit, you could be sitting in the wrong chair, the wrong recliner, but because of the biomechanical way that it positions you.
I think these chairs me and Eddie sits in irritates it because sometimes...
Is that so?
Yeah, sometimes along about 10:15, my legs like going, oh, please, I'm going to let 11 o'clock come on. How it pulls. Pulls the thing I want to say about it. It's like...
The level of your legs can affect the pain going down into your leg. If the chair doesn't have a good backing and your seat sort of slides backwards and arches your back, that can put more pressure on the nerves in the lower back.
What about the actual seat of it? Should it be soft or should it be...
That's definitely not hard. One of those, when you have pain down your leg, you go to church, people tell you all the time, I almost didn't make it through church sitting on those pews.
Oh, yes.
Oh, my God.
Or some restaurants have wooden chairs and you're bending your legs, hit right where them chairs end. And I'm going,
I jokingly tell them, I say, listen, take your lawn chair, go down there right in front of the pastor, right there where the pew is, and sit there and say, I'm here with you. And, so take your chair. It's okay to do that. You don't have to sit in that pew.
Caller, go ahead.
Yes, I'd like to ask the doc, could he straighten up the arm, it won't straighten up all the way, try in the elbow.
So you have a problem with your elbow and you can't straighten your arm out?
Right.
Okay. Did you fall on it? Did you injure it?
Well, I jammed it here a few weeks ago. I fell.
Did it swell on you?
Yes.
Okay. And so since that time, is it very painful?
Yes.
Okay. When you have an injury like that, for example, if you hit the elbow itself and you hit that bony part, that can be sore for a long time. But if you're actually having trouble straightening your arm out, you might want to go and get that x-ray. Just make sure you don't have a chip or a fracture there. You could have injured the ligaments or the muscles, and a doctor can tell you which that is. Did you actually have a fracture or did you have a sprained strain? And once that's determined, you can have if you've had it going on and it's not getting any better, you can get some therapy to that a lot of times help you with that pain.
Well, I didn't land on the elbow. I landed on my hand. It's more like a gingham, I guess, but it's crooked and it won't straighten up.
I would tell you to go to your general practitioner, or you can come to our office and we can take a look at that. We treat shoulder problems, elbow, wrist, knee, ankle. People, a lot of times they think we just deal with the spine. And actually, we deal with the musculoskeletal system. So a lot of times we rehab shoulders.
You deal with who?
What's that?
Musculoskeleton.
Oh yeah. Well, basically, it's the spine and the extremities and the muscles that surround that area, the ligaments. We are capable to evaluate those, diagnose them, treat them if they need to be treated, and that type of thing. So.
Yes, I've been to Dr. Price several times. If anybody could straighten it out, I know he could,
Yes, sir. And the wonderful thing at our clinic, I've been there for 8 years now. I started there when he first built that 5,000 square foot beautiful clinic here on 2A and 3 Notch. And it's been a delight for me to work there. We have spinal decompression to work with disc problems. It also helps with pain down the leg, sciatica, osteoarthritis, back pain, neck pain. So we can, if you have a disc problem, we can work with that. Matter of fact, we added a 6th spinal decompression table to our practice because it's so in demand. I mean, we keep those tables going all the time. So, and they help with that. But what I was going to tell you is we've just gotten a new powerful laser that helps with pain in joints such as elbow, the wrist, the shoulders. It does feet. It does a very, very good job with that. Ultrasound, electrostim. We have just about all the modalities that we need to help rehab these particular areas of the body.
Okay.
Thank you, sir.
Thank you.
Thank you.
I have leg cramps. What causes that,
Oh, there can be so many things.
It's,
Your low back. If you have a chronic lower back problem, it can cause your muscles in your legs to cramp. Of course, your nutrition can, a lack of potassium and other things of that. Not drinking enough water. You could have
drinking enough.
Huh?
Not drinking enough water.
Absolutely.
I didn't
Get
know that.
dehydrated.
Yeah.
Your muscles will cramp up on you and spasm. Absolutely. A lot of times when people have disc problems or other problems, I'll throw a big word at you: spondylolisthesis.
I beg pardon.
Yeah, I know. It's like it makes it sound so smart, doesn't it? But it's when a lot of
Aren't
times.
you smart?
Yeah, L5 will slide forward. It'll put pressure on the spinal cord itself. That can cause weakness in the legs. It can cause muscle cramping, restless leg syndrome at night. But there's that disc problems can cause it. There's a lot of different areas. But first thing I'd say is drink plenty of water. Take you some extra potassium.
well, I do drink a lot of water. I drink a lot of water.
I tell you what. Also, medications can cause you to have leg cramps sometimes.
What kind?
High blood pressure medicines. So you need to check with your general practitioner, your pharmacist, and ask them if that's one of the side effects.
Okay, I never heard of that.
Oh yeah.
Especially if it's got HCT, diuretic in it.
Yeah.
Most of them do. Mine
Wow.
does.
I never even thought about that. I ain't even looked at my blood pressure medicine to see what the side effects are.
Oh yeah.
That's
Many of the medicines, it's a lot of times when people get into their 60s, sometimes they're on 4, 5, 6 medicines, and all of a sudden they start getting loopy, or they start having balance problems, or cramping and muscle spasms, and
You need to.
they need to check with your
You need
doctor.
to take your prescriptions to the doctor and see if this one works against that one. That's
Yes.
what I think.
My father-in-law one time, he was falling over. We weren't sure what was going on with him, but he was in his 70s and he was on like about 10 different medicines, and we sent him to Emory, to a geriatric specialist to check his medications, and sure enough, that's what it was. Wow. And we were wondering if he had some kind of brain tumor, neurological things going on. So monitoring your medication, checking with your doctor, that's very, very important.
My husband took over 40 different prescriptions until I went to the doctor and sat down with him, and I laid him out on the table, and I said, okay, some of these he don't need, so let's so I got him down to about 35 and from several different doctors.
Every once in a while, too, you're seeing 2 or 3 different doctors. This doctor's giving you this,
and
this.
he had problems with balance, and he'd fall and things like that.
Well, a lot of patients, the number one cause of death in people over 65
is broken hips.
Falls. Yes.
Yep.
Yes. So
that's what happened to my husband.
Wow. Oh yeah, you get.
I do everything I can to keep from falling. I'll walk slow. I'll hold on to things and do everything I can because I have a fear of that. If you ever fall.
Yeah, me too.
Oh yeah, and you can injure yourself very much so. It's important to, when you're in your 60s and 70s, to do strengthening exercises for your legs.
Yeah.
And so that you just getting up and down a lot of times. Patients can fall with that. Doing balancing. There's proprioceptive exercises you can do to improve your balance. A lot of times we get people that have so much arthritis in their neck that can actually cause them to be have dizziness and so forth. There's a lot of things that cause it, but there's many times where we will actually begin to loosen up that neck and the arthritis in that neck, and they'll say, wow, my dizziness is gone away. It's doing
sometimes I can't.
Much better.
If you stop straight, sometimes I can't look and see if a car's coming. Not all the time, but sometimes.
Oh, I get patients excited all the time. Doctor, I can see the cars now. I can turn my head and actually see look for the cars and see when they're coming. They didn't realize, that's the thing about the spine. When it begins to fixate on you over years, you lose this. You don't even realize how much motion you've lost. You don't realize that you've lost 50% of your motion in your neck. You can't bend over to tie those shoes anymore. And
don't get shoes that tight.
So when we, a lot of times, even general practitioners, a lot of times when patients have a lot of arthritis in their back, they will tell them, go see a chiropractor. They can give them anti-inflammatories and tell them to get some exercise. Yeah. But they're beginning to realize more and more.
You can't write prescriptions, can you? You can't write.
No, we don't.
Right.
We don't.
We got a caller over here.
And I'm glad we don't, because I had a practice. See, I had, before I came to Dr. Prey's office, I had 3 different clinics. One of them was the MDDC clinic. And so I had medical personnel, PT, chiropractors, and so we had that whole gamut. And what I found out was, once I had a medical doctor in there, I started getting all these people that come in. I just need some codeine. I need some that cotton codeine stuff. That'll fix me up. And so, as chiropractors, people know that we don't prescribe, pain medicine. So when they come, they're like, "I want you to get rid of this pain." Instead of coming and saying, I need these prescriptions for my back pain. And
some people just totally depend on them.
Oh, yeah. So
let's take that caller over here. Caller, go ahead.
Go ahead, caller.
Boy, I hate pain medicine. It makes me sick in my stomach. I don't know how people do it. But I got a 2-3-part question here. Can you help someone who has fell and broke his back and they had to put concrete in his spine? A 76-year-old.
Yeah, did they have a compression fracture?
I think too.
Yeah. And sometimes they'll have to go in and shore that up. The answer to your question is we would have that person come in and evaluate exactly where that pain is coming from. See, what you have to realize is when you have a trauma that is significant enough to fracture those bones, it affects the bones above and below it too. So a lot of times that pain is not only from the compression fracture, but also from the vertebra above and below. They get jammed. So we evaluate, see if those bones are not moving and what nerves are involved. And yes, we treat patients who have compression fractures all the time. Now, if you have a fresh compression fracture, we like to see that try to heal for a while, okay? But after it's healed, that area gently can be mobilized. We can do traction on it to loosen up the adhesions around it and relieve pressure on the nerve. So yes, see, a lot of people, they think if they've broken their neck or their back that they can't have chiropractic. And they can. Right. And we help people all the time with that. Matter of fact, people think that if they've had surgery on their low back or their neck, that maybe they shouldn't see a chiropractor. But a lot of times people come to and they say, I'm afraid that I'm going to have surgery again.
Yeah.
See, when a doctor orthopedist does surgery on your low back, a lot of times when you're going back to them in a year or two and they're talking about surgery again, it's not what they operated on. It's the vertebra and the disc above, because it had to take all that stress for where they repaired the vertebra below. So when that takes place, we can evaluate it. We can use spinal decompression with that, and it will help rehab the disc. It will help with the surrounding scar tissue from the surgery. Sometimes that can come back and cause you pain. So we use that. We can use laser with that when you've had those kind of problems. I'm so excited about chiropractic and what we're able to offer at Pray Chiropractic, because we have a lot of people that's had one or two surgeries and we've kept them from having surgery. Or maybe they have a disc bulge and a herniation. The doctor's saying we might have to do surgery on this, and we've been able to rehab it. And we have a high success of that. Every once in a while, the fibers are too far gone. We work on them. We say, you know what? You're not responding to care. You need to go ahead and see your orthopedist. And thank God for an orthopedist at that time, Yeah. Just to let you know, yes, we can treat those things.
All right, caller, does that answer your question?
No, not all of it.
Okay, go ahead.
Do y'all do anything for veterans? Do you help them in any way? Anything special for our veterans?
Yes, actually, from what our front desk tells us in our insurance department, a lot of veterans are covered under chiropractic now.
Oh, okay.
Yeah,
Oh, really?
Yeah, probably. A lot of people don't realize that. But what the VA is farming those veterans out to the chiropractic. And a lot of times we can submit the forms and everything, and they can actually have chiropractic covered.
So do you submit it, or does the veteran submit it?
You come to our office, and we have highly trained front desk personnel and insurance personnel who will walk you through it and can, if it can be approved, they will get it approved.
The last time I came to your office, I had to walk out because you did not accept my insurance. So that was my next question. I desperately need some help, but I need to know, do you take Medicare and Medicaid?
You're asking me a question that, as a doctor, I don't. We let the front desk, but I will tell you this: Medicare, yes, it does cover chiropractic. Medicaid, no, it doesn't. And in general, there are some exceptions, and that's why it's very important. If you call our office and you say, "This is what I've got," does chiropractic cover this? I mean, is it covered under? We'll accept chiropractic, and they'll tell you, "Listen, our front desk is one of the things we take pride in." Is our staff is trained exceptionally well. Our thing is to be quick, efficient, pleasant, make your stay there very pleasant. And before we do anything, we always like to say, this is what we'd like to do. This is exactly what it would cost. We always like to approach those things. So what I would suggest you do, call them, because as far as veteran, that has changed within the last year. So if it has been longer than a year, that situation has changed. But they will be able to tell you exactly what can be covered and what is not.
All right. Thank you, sir. Bye-bye.
Oh, you're very welcome.
Okay, caller, you're next over here. Go ahead.
Enjoying the program. I'm almost 84 and don't have any pain, but are you know about the elite exerciser? Do you know about it?
The
About what?
Elite exerciser. Clark puts it out.
Well, can you describe it to me?
Yes, you put it down and you lie down and got a pillow under your head. Put your feet on it, and it moves your whole body. It limbers it up.
Is it like a high vibration?
Not high vibration. You can have it on medium, low, or high. I get on it 15 minutes twice a day,
Yes, ma'am.
and I don't have any pain. I just get on it to keep limbered up.
Well, you know what I would tell you? If it's working for you and you're feeling good with it, by all means.
Keep on doing it.
Be nice at the chiropractor. I believe in chiropractors. 55 years ago, I had to go to one. Of course, she's dead now, Dr. Rosalie Wilson and Dr. McNally at Rossville.
Oh, yeah, that's Dr. Prey. That's the Dr. Wilson. He came in and they sold that clinic to him, and that's where Dr. Prey started off.
They were my ball coach. I
Yeah.
played softball at
Oh, yeah, I
church,
hear
and they
about
were
them
the
all the
coaches.
time.
Yeah.
I was
Yeah.
having back problems then, and the doctor said he'd operate. My husband said, no, let's go to chiropractor. And she even came to my house, Dr. Wilson, a couple of times. And I speak very highly of both of them.
Yeah, I've heard nothing but good
Dr.
things
McNally
about
and
both
Dr.
those
Wilson, yeah.
doctors.
I've had no problems since then, knock on wood. But I do try to stay limber and walk some, and But I'm very fortunate.
All
I'm
right.
enjoying your program.
Thank you.
Thank you, ma'am.
Now, I got one for you. On television, there's this place over, and you know where I'm going with this. This woman gets on there and she says that a chiropractor recommends it. She gets on there and she says she lost weight and no pain, and it steps you. Have you seen that? You know what I'm talking about?
Well, no, I haven't. There's so many out there. A lot of those people are just actors.
Well,
Believe it or not.
let me say this. That
They had a thing on the news where they had this one person, they were a gynecologist, and they were orthopedists, and then there were this. So, a lot of times.
they just put those jackets on and look
Yeah,
like those.
exactly.
Yeah, but
Exactly.
But this is a person that gets on there, and then a chiropractor comes on and says that he recommends it, and I'm thinking, not everybody can let a machine move them like that because it would injure you.
Well, patients always ask me when they first come to us and say they have back pain and leg pain, well, can I go out and exercise? Would that help me? No. You're going to walk on a broken leg? Let me get your spine in shape. Because, see, think of it this way. If those bones are jammed in your back and you decide to go out and vigorously rotate and impact that, you have a chance of tearing the disc. You have a chance of making it a lot worse. So chiropractically, what we do is we take those bones, we call it, when they're jammed like that and compressed, we call it a subluxation. Okay? And so our goal is to get that and get it loosened up and get it moving normally so it won't tear the disc. For example, in your low back, those bones are supposed to move very fluently.
Yeah.
Well, if you turn and it stops before it's supposed to, and you try to go further, that's when it can tear the fibers of the disc in between. Most disc problems with the lower back is I twist, bend it, try to pick up something, next thing I know I was in the floor. It starts off with a spinal problem, okay? And then it turns into a disc problem.
Caller, are you there?
Yes.
Go ahead.
I want to ask him about the machine that you stand up on and it vibrates.
That's what I was just talking about.
Yeah, and it says 10 minutes is like walking 40 minutes. And it's supposed to help you, diabetes or anything. Does he know about that? Or do they have one at his office?
Yes, ma'am, we do. It can be a lot different from the ones that you get on the market, for the stores, because the
That's
vibration.
seen on TV.
Yeah, the frequency's a little higher, a little different, and what we use it for, we can use it to help with proprioception, meaning your balance and so forth. exercising, but we also use it for neuropathy. See, when people talk about, oh, I've got this pain below my knees
Yeah.
and into my feet, and I've got neuropathy, what that is that is a type of nerve damage. It can occur from long-standing lower back problems, disc problems. It can be from diabetes. There are a lot of causes for it, but vibration and sensory input to your feet and your lower extremities can help improve that. And so also laser therapy that we have, we can use that on the feet, and that can help with that also. So to answer your question as far as the vibration, used in the right circumstances for the right thing,
And
it
under
can be very,
supervision.
and under supervision can be very beneficial.
Yeah.
Yes, that Lily's, they always advertise that on TV.
That's what I was just talking about. And I think you'd have to be supervised to do that.
I do
You just
too.
couldn't take it and put it in your house and do it. I mean,
I think
the first time you
Alvin-
did it, I wouldn't think you'd be able to walk the next day.
Alvin had one of those. I don't know if he still uses it or not. Okay, thanks.
Okay,
You're
thank
very
you.
welcome.
But you do have them at your place?
Yes, we do.
And they
We do.
supervise you, you know. You
Oh, absolutely.
Yeah,
Everything is supervised.
Yeah, you wouldn't want to.
Yes.
You wouldn't want to just get one of those things and get on it.
Actually, we have a technique called it's called Z-Tech, and we use that on a treadmill, and it's you use it for sports injuries too. In other words, we put electrodes on the lower back, and it stimulates the muscle while you're in action and while you're walking. If you have a shoulder and it's partially frozen, we can use that on your shoulder and we ask you to do certain motions with it in order to rehab that shoulder. See, that shoulder may need to be mobilized because it's adhesive. We can do this with it. We can use ultrasound. We can use laser. See, that's why I'm excited about what we're able to do. We're able to rehab
Laser's
a lot
the
of
latest thing, isn't it? A laser.
Laser is coming along. We have one of the most powerful ones out there, and it helps with healing and with pain relief.
I've had laser treatments.
It stimulates the mitochondria of the cells, and it can help with that. It also helps a little bit with scar tissue. You can't make scar tissue go completely away, but we have found it to help with that also.
Caller, are you there with your question?
Yeah, I got in kind of late, so somebody might have mentioned it already. What about this machine you hang upside down on?
Inversion table. Yes. We get that question quite often too. And
What is it?
inversion table. It's a table that it teeters. You get on it, you strap your feet in, and then you turn yourself upside down. The gravity of it sort of separates the lower back a little bit. And people ask me, for example, someone will come in, they're bent over, they're in pain. Well, should I get on the gravity inversion thing that I got? And I look at them and say, no. Not that it's not good for you in the right circumstances, but it's when you have a disc problem, when you have that kind of pain in your muscle spasm, that really, you shouldn't do that. You can make it a lot worse. I tell people, after we get your spine loosened up and we get you out of pain, if you want to do the inversion at home, yeah, that'd be fine.
I wouldn't want to do that.
But I will tell you this, a lot of people don't think about this, but if you have a vascular problem or a heart problem or a blood pressure problem, you're in your 60s or late or older, you might want to be careful about turning yourself upside down.
I would think so.
yeah.
Yes, and people don't think about that.
If I was in my 20s, I'd be thinking about talking about something.
yeah, you got to be careful about. And the other mistake they make is you really only need to hang on that thing for about 5 minutes. There's people that get on it for the first time and hang for about 10, 15 minutes, and they can't move the next day.
Oh.
So, yeah, I would tell you, check with your chiropractor. He'll let you know when it's a good idea.
Alrighty, thanks.
You're welcome.
I have lower back pain sometimes. and sometimes I get on a weight bench and go down as far as I can and come back up. Is that good to do or something?
I don't know. Does it hurt?
Yes, it hurts. It hurts. It hurts.
Then don't do it.
Okay.
If it don't hurt, send it with.
I'm a firm believer in Eon. If it hurts, don't do it.
Okay.
Okay?
All right, but I don't want to. I mean, I know as you get older, you're going to be bending over,
Yes.
but I want to try not to do that. you
Yeah.
know.
Well, there's
Oh, you're talking about your posture. You know,
Yeah.
that's a good question. Do you all ever do anything about posture?
well, when you have a spine that's not functional, you know how people develop a hump as they get into the
I
system?
know.
Yeah, I've seen that. Yeah.
Well, that doesn't just occur. The spine begins to get fixated and not moving. The spine tries to adapt, and maybe you get some osteoporosis too, and that will cause an accentuation of that hump. If you take care of your spine early on and you work with weights and exercises, you can prevent that from getting as severe as it does. Now, when you already have it, we can help you with the pain. We can make you more flexible. We probably can't get rid of the hump completely, but we can hopefully slow down that process of how bad it gets and how fast it gets bad. So that's very important to realize.
Here's something I've always wanted to ask, and here it is. Does everybody that comes, is the starting out thing, pop your neck? You know what I'm talking about?
Now, what are you? Ask that question again. You mean to the chiropractic clinic? No.
Is that what happens to every patient? You know, when they first go.
Oh no. Sometimes people come in and they have low back pain. What do we treat? The low back. But so often everybody waits until they're falling apart.
Yeah, that's right.
I've already
Oh
felt
my gosh!
I know. Wait,
Sometimes we laugh. Wouldn't it be nice if they only had neck pain or just a low back pain? But when they come in, I've got headaches 5 times a week, and I got numbness and tingling going down my arm, and my low back spasms up on me, and I got pain down my leg, and I'm limping. And I mean, it's like they let their spine get in such bad shape, and pain eventually drives them into us. I had a lady one time, and she'd went to orthopedist, neurologist. She had pain down the arm. They did an MRI, CT scan, this kind of thing. She didn't have a disc problem. And they really couldn't tell her what the problem was. Mm-hmm. And she came to me and she looked at me. This is the truth. She says, I paid $5,000 out of pocket. I've had this for 8 months. I'm crying with pain in my arm. I think you guys are witch doctors, but I'll do anything if it will help me. And sure enough, her neck was all jammed up. The curve was reversed. There was a lot of pressure on the nerve. She didn't necessarily have a disc problem. And I was glad that she had already seen the orthopedist and everything. It helps her rule out some things. And I said, you've had this a long time. Give me 4 weeks. This is not going to go away easily. So that woman, she, about 4 weeks later, her arm pain was almost gone completely. By the time we got done with care, she was gone. But you know what I did to her? At that time, I had a 5-year-old, 2 boys, and they had an Indian headband. Like a chief, and they had maracas, and they'd been over my practice, and they had that setting over there.
And so put it on.
So this lady, she comes in, she's laying down there. I said, and she's laying face down. I said, we'll call her Mabel. I said, Mabel, I'm going to try a new technique on you. You trust me, don't you? Yes. Oh, yes. You've helped me so much. I put on that Indian headband. I started going, hey. She looked up. She turned red in the face. She said, oh, my gosh, I deserve that, don't you?
I bet you're a fun guy. Caller, go ahead.
What do you think about epidurals?
Epidurals sometimes can help you. Sometimes they don't. Let's put it this way. An epidural will help with inflammation in the area, will help deaden the nerve so that you don't have much pain. Sometimes people will get an epidural shot and it helps them zilcho. Sometimes they'll help them for 3 weeks, 6 weeks. Sometimes they'll get relief for 4 months. But here's what an epidural doesn't do. It doesn't correct the problem. So
Temporary fix.
yes. So even if you get relief from that, there's a good chance that you're still heading possibly for surgery in the future. When it's just like when you go to a pain manager, they just keep giving you drugs. What we want the community out there to understand is this. If that spine is dysfunctional and not moving and putting pressure on the nerve, deteriorating the disc, injuring the disc, if we can get that moving again, loosened up, get pressure off the nerve, that will make the disc healthier. A lot of times we can get that individual out of pain and they can do very, very well. Sometimes we can't get rid of all their pain. Sometimes we even have to manage them and keep it loosened up because they've let it go so far. Every once in a while we have to refer that person out. But, the orthopedists, again, we thank God for them. I mean, listen, they're highly skilled, and sometimes when you need that disc trimmed up and you need some hardware, sometimes that's what keeps you going.
Did you know they only have one language?
What's that?
Knee surgery.
Knee surgery?
Knee surgery. That's everyone you go to is not happy.
Well, a lot of orthopedists are specialized, like with the shoulder, the knee, or the back.
And I need knee surgery.
Listen, we get orthopedists all the time that say, listen, you're not ready for surgery. Go try chiropractic.
Will you go 2 or 3 times a week or twice a week? Or
It all depends on what is wrong with you.
the average, though, is...
Well, let's say that you've had a problem in your low back and it's bent and you got a disc problem and you've got spurring going on. That's probably going to take a while to rehab. Now, it doesn't mean that you can't get out of pain pretty quick. Sometimes people come in and they have a terrible spine and they can get out of pain and fairly quickly. I'm talking about people that are crying in spasm and can't hardly get on the table.
I did that.
Sometimes within a week, you've been there. Sometimes
Been
within
there,
a
done
week, they're like, oh my gosh, I'm so much better. But sometimes it can take 4 or 5 weeks because it's so acute, so swollen, so bad that we have to go slowly with it. So it can take a little bit. But I will tell you that when you come in there, if it's an acute case, you're going to be seen frequently for a few weeks for sure, okay, to start getting it under control.
Okie dokie. We're talking to Dr. Nick. We're talking about stopping the pain. A lot of you out there, we've already found out a lot of people's got pain.
Yeah, Judy, we not only can we stop the pain here in the Ringo area, we have our new practice down in Dalton. It's 4,000 square foot, and we have Dr. Riveras, and he is bilingual. He speaks Spanish fluently. He's a lieutenant colonel in the Army Reserves. And he is...
He'd be neat to meet.
Oh, he is. He's a very interesting person, very good doctor. Yeah. And that has been open since I'm thinking about the middle of February. It's already growing. There's a lot of influx of new patients there.
Right.
And it's equipped, just like the practice here in Fort Oregon, Fort Ringo
we're on Dalton
area.
Utilities. We cover Dalton, so you...
What's that?
We are on Dalton Utilities cable, so folks in Dalton can watch us.
Oh, well, yeah. Then it's right there. It's off of, you go from here.
Thornton Avenue.
Yeah. Walnut and Thornton Avenue. Yeah, exactly. And it has a
Where
very...
is it? At the overpass?
No, it's right there at the red light where Walnut and Thornton meet. Right over there. It's a...
Steak and
It
Shake
used to be a
across the
bank.
street. Huh?
It used to be a bank right there.
Oh, okay.
Yeah.
Is Steak and Shake across the street? I can't figure out which.
I don't know for sure.
Is that
Brian Plaza?
Brian Plaza. Is it Brian Plaza?
I think so.
Brian
Yes.
Plaza. Okay.
Yes.
Thank
Yes.
you. A
But,
voice in the control room.
Yeah. But
Thank you.
I had the privilege of working there on a Saturday morning not too long ago, and it's a beautiful facility.
I don't think a lot of doctor's offices, chiropractor offices open on Saturday, are they?
No,
That's unusual.
they're not.
No, that's a good
No,
idea.
I would say there's no practice. I'll say two things. See, I had 3 clinics, and then I retired from my last one, and I did consulting work and I did fill-in work for other doctors. And one of them happened to be Dr. Prey. Staff liked me, patients liked me. So when he started the new clinic there in Fort Oglethorpe, they said, would you come, move here, and be an associate doctor? And I'm like, let me think about it. Okay. And it's just been wonderful being there during that time period. Your question a while ago was what now? I got to talking about that, and I forgot how we got there.
I said there's not very many doctor's offices or practices open on Saturday. Dr. Arlen.
Right. No, there's not. But what I was going to tell you is filling in for a lot of doctors all over through Georgia and everything. I will tell you this. Dr. Prey's office is the most efficient, well-trained, and busiest chiropractic clinic I think there is in the Southeast. It's definitely one of them. That's for sure.
Right.
And that's what makes it so wonderful to work there.
Well, you got a great personality and a gift of gab. And, I think that's what it takes to make people feel better. Now it's going to get well if you're at
Probably if you ask some of my patients, they would say, Doctor, yeah, he's crazy. I will, I'm sometimes I almost get in trouble.
Yeah.
I was just a patient and they passed gas.
Yeah.
And we're just going to call her Miss Arnold, okay? And I said, Miss Arnold, what's that perfume you got on? Is that stink all right? And she, leave me alone. I'm so embarrassed and everything. And, one of these days, one of those ladies going to get up and hit me. But, but so we have fun. I mean, it's fun. And patients.
Have fun.
Oh my gosh, we have patients that are hilarious. Oh my goodness. I mean, it's fun to capture.
I bet you could write a book about some of the things that happen.
I thought about that.
Yeah.
I just have to change the names to protect the innocent. And probably me too.
Tell us the funniest thing that's ever happened.
Well, I thought that was pretty funny.
Yeah, I think so
the
too.
voodoo thing over the lady and that kind of thing.
And the one with the hat, the Indian hat.
Oh, I know something that was hilarious. Oh my gosh, I was so embarrassed.
You were embarrassed. Okay.
Oh yeah, this lady came in. She had low back pain. She'd been trying to get pregnant for about 3 years. Okay, fairly young, and gone through fertility and everything, but she'd had a lot of low back pain. I said, "Listen," I said, those nerves do go to your uterus and so forth and everything. And no, you do have a back pain. I'm going to treat you with it. I will tell you that it has been known that, someone that was having difficulty was able to get pregnant. So, anyway, I'd been working on her for about 8 or 9 weeks. She comes storming into the clinic, into the waiting room, was full, and she's so excited. She said, Dr. Nicholson got me pregnant. and I went in there. I said, Mary, come out here into the waiting room and tell them what you really mean. I've been working on your back and everything. And the staff was laughing, and everybody was laughing, and it was just that was pretty humorous.
Yeah. That was.
But she was excited. But we had another lady that had been barren all her life, and she adopted 3 children. She was about 49, and she said, "Oh, don't worry about, there's no way I could get pregnant. I've been barren all my life." She got pregnant. That lady was not happy. I mean, she was not happy. And,
did you have anything to do with that?
She did have a miscarriage.
Did you have anything to do with that?
I treated her back, okay, and everything. But that was a different response. She was like, "Oh my gosh, I'm 49, and I'm pregnant and everything." So, but I just tell you, patients most of our patients are just so delightful. Sometimes when
It's kind of down home goodness, I gather.
huh?
Down home goodness.
It is, and we just we even forget sometimes when people come in, they can't hardly move around, they can't get off their sofa, they can't play with the grandchildren, and the next thing you know, I'm doing whatever I want to do, and we take it for granted, and sometimes we forget how wonderful our practice is and what we're able to do. We got wonderful doctors as there. You met Dr. J. He is a card. He is.
He's well versed too.
Yes, he is. All our doctors, Dr. Prey, just as when he picks his staff to work for him, he demands perfection from his doctors.
I remember
too.
when he started out. It's maybe 30 years ago. Do you know?
It's been I think 1985.
85. Let's see.
I think that's when he met up with Dr. Wilson and them.
But I didn't meet him until about between 85 and probably 88 or 90. Yeah. He was on the show. I kind of introduced him. When he started his.
Oh yeah.
Down the street.
Do any of your patients have a weight problem, or?
All you gotta do is go to Walmart. Yeah, they do.
Yeah.
I mean, there in the United States we have a weight problem.
Yeah, we do.
We really do. And and people ask me sometimes, being overweight, is that what caused my back pain? And usually my answer to them is no. It contributes to it. It may make it deteriorate faster, just like it would your knees if you put all that weight on it. But a lot of times it's not necessarily the cause of the problem. It's usually picking up something too heavy, bending awkwardly, falls, injuries, car wrecks, sports injuries, things that happened to you maybe 5-8 years ago, and all of a sudden they're now deteriorating and getting worse. I mean, think about it. Someone says, all I did was bend over to pick up a piece of paper, and all of a sudden I couldn't move. They go to the doctor. He says, well, you got a sprained strain. Well, really? A sprained strain? Well, in a way that could be true in this respect.
Sprained strain? Is that what you said?
Yeah. But in a way it could be true because your spine's gotten so unhealthy, the threshold was lowered. It didn't take much to really lock that up and put pressure on the nerve.
Let me tell you something we talked about on the morning show. I think affects everybody. Is how you sleep, and that pillow. We were going to talk about that pillow, the water pillow, and how you sleep. So Dr. J said to get you a long pillow, one you cozy up with, a buddy.
Yeah, he's talking about a body pillow.
Yeah.
And if you're laying on your side, people like to take that bottom leg and let it roll over and torque their back. Yeah. And so he's talking about a pillow that you can put your leg over there and it keeps your pelvis level. Now the other thing you
can put a pillow between your knee and it makes your...
Yeah, but people usually try to put too thick a pillow. It only needs to be about 1.5 inches to 2 inches. Because if you get one that's like 4 or 5 inches, it actually has a good chance of causing your back to hurt.
You have your feet above your head if you did that.
Well, it's what it does is it causes sort of like a bow in there. But definitely sleep on your back, both knees up in a fetal position. Most people can sleep comfortably that way, as far as their lower back.
You mean bend your knees up? What I'm talking about?
Yeah, bring them up and keep them together. It's when you let that bottom leg on the bed straighten out, and then you let that top leg roll over. And if you think about it, your hips are torqued. You lay like that for 8 hours, people get up and they're like, man, I'm in pain.
I do like this, and lay on my side.
The worst way you can sleep is on your stomach.
Oh, I couldn't do that.
Oh, my gosh. I mean, think about it. If you torque your head like this, and you sleep like that for 8 hours, and you wonder why you got a crick in the morning.
Yeah, I get one anyway. And I sleep on my side and on my back,
Yeah, unfortunately, as we get arthritis and these kind of things, and we have spinal problems, it gets easier to get a crick. All you got to do is have it turned a certain way, it hits that nerve. And but that's what brings the patient in a lot of time to us. It'd be wonderful. I think everybody at different stages in their life are to go to a chiropractor and get their spine evaluated and find out if it's functioning good. Because when they get those subluxations that maybe not cause them very much pain, over the years, those bones grind that disc down and deteriorate and make it unhealthy. If you get it taken care of when you still have healthy disc, you're gonna be a lot healthier with your spine, go a lot further. There's a lot of people having to retire early because they don't get the proper spinal care.
All right, we got a caller on here. Are you there?
Yeah, I'm here.
Okay.
I had to turn the television off. I can't get my muting straightened out. I have fibromyalgia very badly, and I have fallen twice this week, and then my body's so weak I can't do anything. I looked up ataxia today. Now that is the word that has all these things under it about falling, right?
The what?
The
She
what?
looked up what?
Ataxia.
Oh, ataxia. Well, you have fibromyalgia in your legs and your feet. How long
All
have
over
you?
me.
Okay.
My shoulders, arms, neck, you know it.
Okay. Well, here's what I want to tell you, and people have to be careful about this. There are 20 indicators that doctors look at to tell you whether you have fibromyalgia. Okay?
I've gone through all that 10 times.
Right. Well, here's what I want to let you know, though. A lot of times, when your spine gets dysfunctional or very arthritic, it will cause your shoulder. You can get bursitis in one shoulder than the other. Your neck is tight. Your muscles become splinting. You ache all through there. And now you've also got a problem in your lower back. What we have found is at least 50% of the people that say they have fibromyalgia have spinal problems that chiropractic can help, and they really don't have fibromyalgia. There is a such thing as fibromyalgia, was the inflammation of the sheath of the muscles. But we've found probably more than 50% of the time that these people just have a lot of spinal problems, putting pressure on the nerves. Those nerves go to your muscles, and that's why those muscles ache and you have pain. So before you get tagged with fibromyalgia, definitely come to our office and get evaluated. You may have a lot of spinal problems that we can improve, and you'll find out that maybe you don't have fibromyalgia.
If nothing else, he's got a balance machine. She has problems with a balance. And I found this article and I saved it to you, called, and I was going to give it to you or read it to you about an exercise to reduce your risk of falling.
Yeah, if you're talking about falling, it's very important. Well, first of all, if your spine is not flexible, you're going to fall because you lose. And then when you get nerve problems into your extremities because of your spine, you're more apt to fall. As you get older, your muscles become weaker. You got to strengthen those, like you're probably going to talk about a little bit there.
It says if you need to help improve strength in your quadriceps. It's a large muscle located on the front of your thighs. Anyway, it says to stand in front of, it says to strengthen them, this is an exercise. Stand in front of the first step at the bottom of the staircase. Hold on to the banister for support and place your right foot on the step. Lift yourself up onto the step. You with me? Lower yourself back to the floor, onto your left foot as you step down. Repeat 8 to 12 times, then switch to the other side and repeat 8 to 12. As you get stronger, try to step up without holding onto a support. I tore this.
I've done that about 10 times.
Well, I brought that for you. I found it the other day.
And
I'm glad you were thinking about me, but
I was.
I have. Every time I go to therapy, that's what they make me do.
ma'am, another thing you can do is you put your you put a chair next against the wall, and then you get next to it and put your back against the wall, and then what you do is you slide down the wall, and until you're almost at a 90-degree angle, and then you push yourself up, and that will work your quadriceps. And if you get down there and you're like, I don't know if I can get back up, that's what the chair is for, so you can lean over there and use that chair to help you up.
I wonder what the chair's for.
Yes, ma'am.
That's what's happened to me. See, I've had to call 911 2 or 3 times. And well, let me ask you this, and I've forgotten the name of it, but for years I've had now I forgot, L5 and L6. I think there's something. But now I've taken that to some other doctors, and they say that's nothing.
You have your L5 is what? Deteriorated?
They're deteriorating.
Yes, ma'am. Again, we, chiropractic, many times can really help you when you have deterioration of the lumbar spine, L4, L5, S1. That's real typical with people. And we have soft techniques, stretching techniques, and we can gently get that area to move. And when you do that, it can get pressure off the nerve. But what it does is it also slows down the rate of how quickly that deteriorates, and also improves the disc, where you're not going to be tearing the disc up so much by getting those bones to move. So again, please give our office a call and get that evaluated, because we help that type of thing a lot.
Well, does Medicare cover any of that?
Yes.
Yes, ma'am.
Oh, okay.
What kind of insurance? What's your supplement?
TRICARE.
Well, I have Mutual of Omaha and Medicare, and it. I go. Y'all know I go to Dr. Ford some, and it pays it.
Mm-hmm.
Well,
And
see,
they'll send me a reimbursement too back.
See, by Daryl being a service person, I can't even talk.
A veteran.
And he was a career person. He said, well, see, I get the TRICARE free, and I get my Medicare.
Mm-hmm.
Well, we don't really get it free. They take some out
Yeah.
every year, but it's still good. I have a lot better plan than so many people.
Well, give them a call. Let me tell you. You can remember their number. It's
Well, I know where they are.
706-935-PRAY 7729.
Yeah, and the girls will be able to answer your questions as far as whether your insurance would cover chiropractic or not.
Okay. All right, then. Well, I certainly thank you. I got to have something, or I'm going to die pretty soon, I believe.
If nothing else, he's got a balance machine down there, and you're talking about losing your balance.
Yeah. We don't want you to die, so come on and see us, okay?
Well, I can't help it. I've got that in my mind that I'm not going to live much longer because I'm just so miserable.
You know, we get a lot of people, again, that feel that way. And when we can't help everybody get back to the levels that they want to, but a lot of times they're like, I'm healthier, I'm stronger, I can do more things that I used to do, and that makes life wonderful.
Yeah.
Yeah.
The quality of life is important today. We thank you for coming and joining us.
Yes.
You've been an absolutely perfect guest. We've had so much fun with you.
I've enjoyed it. It's been fun.
Yeah, time passed.
It does,
You've
yeah.
been here a whole lot longer
Yeah.
than
Yeah.
people.
Yeah,
I told him he'd get to stay, but it don't matter because we
Yeah.
enjoy having people.